I'm Carlos Marchena, the last one of my presentation. I'm not the first author of this work, but I'm the presenter in representation of my team. I'm going to talk about the relationship between the positive symptomatology and therapist action. Let's go. In the later years, our research team has been interested in the study of the psychological and in the study of the therapeutic process from a functional analytic approach. We are interested in a study how the therapeutic change happens. In this sense, we agree with other authors who speak that the therapeutic process can be considered a shaping process in which the therapist, by the use of the contingency, can promote the decrease of the disadaptive behavior and the increase or maintenance of the adaptive behavior. And this process is common in every psychological intervention, independently of the approach used. If we look back to the research in this issue, in the behavioral paradigm, we can find some studies that, for example, Rosen and Davison in 2003, who speak about the need of the identification and application of the scientific principle which can explain the therapeutic change. In the same way, Castaway and Beutler in 2006 speak that the therapeutic effectiveness can be explained by some factors in which we can find the therapeutic relationship. For this reason, from 2006 to the present, our team has been interested in the study of the therapeutic relationship. And given that the therapeutic relationship is a verbal interaction between therapist and patient, we have studied the verbal behavior of the therapist and the verbal behavior of the patient and the verbal interaction between them. Out of the behavioral paradigm, we have other studies, like the study you can see in the slide, in which the author conclude in the same way that it's important to research in looking for these behaviors that help to a therapist to improve their actuation. So what's the relevant? What's the relevant in the study we want to present today? The relevant is the use of a new approach, the functional analytic approach, to a new context, the psychiatrist context, with person with severe mental illness, and in the management of positive symptomatology, delirium, hallucination, and disorganized language. In this way, our team has adapted the categorization system of the verbal behavior to this new context, and we have found some relevant, significant differences between both contexts, between the psychological context and the psychiatric context. What you can read in the slide, we have the categorization system of the verbal behavior in therapist and in patient. And in the case of the patient, the non-functional verbalization is the new one of this context. And in the case of the patient, the delirium and hallucination and disorganized language are the two new categories added in this new system of categorization. What's the aim? The aim of the study we want to present today, given that, as I said before, the therapeutic process can be considered a shaping process, we want to describe what the therapy does when the patient experiences any kind of positive symptomatology. So we want to know firstly, we want to describe what the therapy does after the mission of any kind of positive symptomatology. And secondly, we want to describe what's the response of the patient after use of punishment or reinforcement by the therapist. And last third, we pretend to clarify and understand the therapeutic change process that help to the professional to improve their actuation. The method used, we observed 6 clinical sessions treated by one eclectic therapist from a private company of Madrid in Spain. And we used the Observer software to record, to observe, register, and code the sessions, a closed video circuit to record the sessions, and the therapist and patient verbal behavior categorization system. So the variables we studied were the therapist verbal behavior and the patient verbal behavior in the interaction context. Regarding to the procedure, we get the collaboration of the patients. Then we recorded the session, and we observed, registered, and coded the sessions. Finally, we analyzed the occurrence of each category. What are the results we have found? To the first question, what does the therapist do when the patient experiences any kind of positive symptomatology? We have found that the therapist used more frequently the discriminative, informative, and reinforcement. To the second question, what is the response of the patient after the use of the punishment or reinforcement by therapist? We have found that every time that the therapist reinforces the positive symptomatology, the symptoms remain. However, in the case of the punishment, just in almost 70% of the time, the symptoms remain. So what we can conclude with the results? Firstly, we want to remark the importance of the therapist actuation to modify the patient behavior in session. However, we have found that the reinforcement is most frequently used than the punishment after the emission of positive symptomatology. So if the therapist want to decrease this behavior, maybe it's not being systematic enough in the application of the contingencies. Secondly, we have found that the category most frequently used by the therapist are the discriminative and informative. And in the case of the discriminative, maybe the therapist wants to redirect to the patient to the aim of the session, and not to give importance to the symptoms that the patient is experiencing. In the case of the informative, it's probably that the therapist wants to give information about the symptoms, the positive symptoms, in order to train him to what to do when he's experiencing the symptoms. And finally, we have found that effectively how we can expect it when the therapist reinforces the positive symptomatology, the symptom remains. However, in the case of the punishment, just in the 33% of the times, the punishment seems to have an effect on the behavior of the patient. Maybe the therapist is not using a punishment intense enough, and for the reason has an effect on just sometimes. Finally, we want to remark that we have present today a preliminary and descriptive study that we are now at the present replicating with a larger sample to generalize the results, and we want to put in relation to the effectiveness of the treatment. Secondly, it's necessary the use of inferential statistics in order to generalize the results, like for example the sequential analysis that we are using at the present. And in long term, we pretend to carry out experimental studies in order to prove if what the therapist does in session has a direct effect on the behavior of the patient. Thank you very much for your attention.